Welcome back. You're watching McLaren-Port Huron's Today's Health, and I'm speaking with board-certified cardio-thoracic surgeon, Dr. James Martin, and in this segment we're going to be talking about the mitral valve. All right, let's start at the top again. Anatomy of the mitral valve. Where is it? What does it do?
Okay, well, the mitral valve is the inflow valve to the left ventricle. So when blood gets pumped by the right heart to the lungs, it comes back to the back of the heart here to the left atrium, and then when the heart's ready to fill with blood, it moves through the mitral valve into the pumping chamber. Then when the left-sided pumping chamber pumps that blood to the body, that mitral valve closes and the blood gets pumped forward. So it allows blood in the heart but not back out.
And what are common problems with the mitral valve?
So the most common problem with the mitral valve is called mitral regurgitation, which is leakage of the mitral valve. Mitral stenosis can also occur in the mitral valve, which is blockage of the mitral valve, and that usually occurs in patients who've had rheumatic fever as a child, and it usually means replacing the valve. For mitral regurgitation, the most common problem with the valve, there are a number of reasons why people can get that, but in the majority of instances, we can then repair that valve, fix the patient's own valve, and we do not have to replace the mitral valve for mitral regurgitation in the vast majority of instances.
What are some of the causes of mitral regurgitation?
So the most common cause of mitral regurgitation is what's called mitral valve prolapse. And mitral valve prolapse is a common disorder of the mitral valve. The valve is floppy, the tissue is excess, and we don't really know why people get mitral valve prolapse. Many people will be diagnosed with that at a very young age and will have it for their whole life. 90% of people with mitral valve prolapse will never develop a severe problem with their mitral valve. So despite the fact that a lot of people have mitral valve prolapse, only about 10% will eventually develop severe enough leakage of the valve that they would need it repaired. Other reasons that the mitral valve can develop leakage are infections in the mitral valve, what we call endocarditis, or ischemic problems with the mitral valve that are from heart disease and heart attacks. Finally, some patients will develop dysfunction of the heart for other reasons than ischemic disease or heart attack type disease. And we call those idiopathic cardiomyopathies, and many of those patients will also develop leakage of the mitral valve. In general, myxomatous disease related to mitral valve prolapse can almost always be repaired. Leakage of the mitral valve related to infection can frequently be repaired. Leakage of the mitral valve related to undefined dysfunction of the heart, what we call cardiomyopathy, can usually be repaired. And mitral valve leakage related to heart attack type disease, ischemic mitral regurgitation, can be repaired in some instances. And that's actually the most controversial right now in America, is how many of those patients should be repaired and how many should be replaced. And that's an area of active research.
What kind of symptoms might someone have if they're having this problem?
So almost all patients with mitral valvular disease who have symptoms will have symptoms of shortness of breath. Sometimes because the valve is leaking, it causes enlargement of the filling chamber. So the filling chamber is getting blood coming from the right side of the heart through the lungs, and now with the valve leaking, it's also getting blood pumped backwards to it from the leaking mitral valve. That causes enlargement of that filling chamber, and that can cause an abnormal rhythm of the heart that we call atrial fibrillation. So some patients with mitral valvular disease may present as their first symptom of having a racing heartbeat, again, typically associated with some shortness of breath. Interestingly, Many patients with mitral valvular disease from mitral valve prolapse will have no symptoms or very limited symptoms. And yet, if they have severe mitral regurgitation, we still like to fix those valves because the heart function over time will worsen, and it may be that they don't get symptoms until their heart is quite weak. At that point, if we fix their valve, the heart may not recover. So if we have patients, even without many symptoms, who have bad leakage of their mitral valve, in general, our recommendation is going to be to repair that valve sooner rather than later in order to preserve their heart function and make them live longer.
How do you diagnose a mitral valve problem?
So mitral valve problems are generally diagnosed initially with a stethoscope, so we can hear a heart murmur. And then to really clarify exactly what's wrong and how bad it is, we'll start off with a surface echo, where we'll do an echocardiogram, which is an ultrasound of the heart done by putting a probe on the chest and looking between the ribs at the heart muscle. Frequently, it's hard to get really good images of the mitral valve with surface echocardiography, and in most instances, once we know, and as we're planning an operation in order to fix the mitral valve, we'll want to do what's called a TEE. TEE stands for transesophageal echocardiography, where we take that same ultrasound probe that we had on the outside of the chest and we put it on what's called an endoscope, and we pass it down the patient's mouth into their swallowing tube and take the echocardiogram pictures from the inside. That's done with the patient sedated, so it's not an uncomfortable procedure for the patient, and it's a quick outpatient procedure, and it gives us phenomenally beautiful pictures of the mitral valve in the majority of instances.
Well, we are going to take a break, and then I'm going to ask you to actually walk through repair for us. But first, let's listen to this message.
Thank you.